Newer advances in IVF. IVF started since 78, the first birth of baby Louise Brown. The percentage of success, which was 10%, has now, with advances in technology, advances in the procedures, can almost reach up to 50, 60 and 70%. But then what are these newer advances that are happening now, which is increasing your chance to get a success with the IVF treatment? Well, IVF is all about egg, sperm, embryo, uterus and the whole body in general. So let us see what are the advances that are happening when we talk about the egg. The stimulation protocols have changed from agonist to antagonist and now minimal stimulation. We have got personalized stimulation protocols now, ICOS, individual controlled ovarian stimulation. It is no more a blanket protocol for all the patients because the hormones, how you respond to the treatment and what will be the quality of the oocyte if your hormones go very high or if it is low is very important, and each individual will respond differently to the gonadotrophins, and the type of gonadotrophin that is used is also very important. The second important thing is when we do personalized stimulation protocols, the chances of cancellation is very low, chances of getting into good quality oocytes is very high, and chances of cancellation of a cycle becomes very low. For the poor responders, now egg donation is no more the first or even I would say the very last resort for treatment option. The female herself can have her own eggs being utilized, and now we work with what we call accumulation of the vitrified embryos. No woman would want to rest or wait for those 15 days before the beta HCG result by transferring just one low or poor quality embryo. Rather than that, it is smart and advisable to collect your embryos. So in each cycle, instead of pumping you with loads and loads of gonadotrophin injections, we have a protocol where you use a tablet like a clomiphene or a letrozole, mostly clomiphene, and just add on few doses of gonadotrophins to maximize the pool of follicles without compromising the quality. Fertilize it, create the embryos, freeze it, and then when you get 4 good quality blastocysts, start thinking for the transfer. Freeze-all strategy is very important and very useful for females where we compartmentalize the cycle, which becomes very patient-friendly, and where we are not worried that the endometrium has advanced and the embryo will not implant. And for the female also, she has just those 10-12 days of injections and the retrieval procedure. She has frozen the embryos and then it is her freedom, at her liberty, she will go ahead with the embryo implantation. And that increases the success. With the vitrification, the success of frozen embryos is very good and a very good, friendly, patient-friendly cycle with good outcome can be done. The other important aspect that now we want is how we improve the quality of the eggs, because whenever you say that you have to go for a donor gamete, it is not acceptable by the females because we want to see our own genes in the next generation. So how do we do that? In the poor quality oocytes, we want to improve the quality. This is both for the men and the women, that the holistic approach to IVF is very essential. A spermatogenesis 64 days procedure and your egg that is recruited is 70 days procedure. So for 2 months prior to your IVF cycle, it is very important that you have your vitamin levels proper, your body is detoxified totally, the vitamin D3 level is also important, take coenzymes, antioxidants, lead a very healthy lifestyle with proper sleeping patterns, healthy food, exercise, meditation, and then you come for the IVF cycle and the quality of the egg and sperm will automatically improve. The other important aspect is for the females who have premature ovarian failure, low number of eggs or low quality of eggs, we can do ovarian rejuvenation, either with the blood platelet rich plasma or with the bone marrow, and this improves the quality and the quantity of the eggs that we are going to get in the next cycle. Oocyte vitrification and oocyte banking. Yes, previously a female, if she thought of getting married late or she wanted a career before she has a child, had no option but to lose her fertility potential, because we know that the women are born with a set number of eggs which get exhausted while she is in the late 30s or early 40s or at 45. But now she has all the time in her life to save her eggs and then decide when to have a baby. So oocyte vitrification and oocyte banking with the recent technology has given this opportunity for the female to save her genetic material and have a baby later in life. The Polarscope, which is used to identify the spindle, is very important, because when you are doing ICSI, you may inadvertently injure it. And with this technology, you will be able to identify the spindle and you do not damage it while you are doing the ICSI procedure. For the men, previously it was just the count and the motility and you say, okay, you are fertile, but not anymore. There are a number of tests that the men needs to go. One is the sperm DNA fragmentation index, especially in obese, smokers, diabetic males, where you will find high incidence. And if it is 25% and less, maybe natural conception, 25% to 50, only ICSI, and more than 50, we need to aspirate the testicular sperms. The other is magnetic sorting of the sperms, where the good sperms are sorted out from the DNA fragmented sperms, and by this procedure we can get good sperms, and that can be used for intrauterine insemination as well as in vitro fertilization with a better outcome. Then when there are no sperms at all, azoospermia, if it is obstructive, a simple PISA or TISA, that is testicular aspiration of the sperm, will help. But if the FSH level is very high for this men, the testes are very small, still in 20% we can find the testicular sperms by doing a procedure which is very elaborate, known as MicroTC. MicroTC, where surgery is done and microscopically the best tubules are selected, the total testis is opened up from the skin, and these sperms are then being, this tissue which is given of the testicular tubules will be screened by almost 4 embryologists at a time, and maybe 15 hours each, totally 60 hours. But at the end, you may find good 10, 12, 15, 20 sperms which you need to have the child of your own. So whenever you have non-obstructive azoospermia, even if your FSH is high, we can do the karyotyping, we can do the microdeletion test, and if everything comes out to be okay, we can go ahead and do the MicroTC, and you can have the genetic child of your own. There are other procedures to identify the best embryo, and one of that is the embryoscope or the time-lapse imaging, where every 10 minutes the picture of the embryo is taken. And when these pictures are then given some annotations, and after that the embryologist will sit in front of the video and give numbers to all this milestones that happens in an embryo, from fertilization to 2pn to cellular stage, and then we identify the best embryo based on the morphokinetics of that embryo, the energy level of that embryo, and then transfer that embryo. The other procedure to identify a good and normal embryo is the preimplantation genetic screening of the embryo, which is very important because number of embryos are chromosomally abnormal, and when you transfer that, either there is implantation failure or there is a miscarriage, or if it survives, could be a malformed baby. So what is done? Once your egg is taken, fertilized with the sperm, you go to the blastocyst and a biopsy is taken from the outer zone, that is the trophectoderm, about 5 to 7 cells. A library is prepared, and then from this library you study analysis done on a platform, next generation sequencing, and you identify a normal vis-a-vis, that is called a euploid embryo, from an aneuploid embryo, and transfer. This will shorten your time to conceiving. this will reduce drastically your risk of miscarriage, and that's why increase your chances of success in a shorter span. We at Akanksha have an in-house NGS platform for PGS, mainly because we want to avoid any error. We want to be very sure that the material that reaches the DNA library that is prepared is properly prepared. The clinical team, the embryologist and the scientific team will come together and discuss each and every embryo, and there is no chance of mistake, giving the flexibility of the time for embryo biopsy, giving the flexibility to the patient to number of embryos that can be analyzed, cutting the cost for the patient, and definitely a faster turnaround time. PGD, pre-implantation genetic diagnosis, when there is a single gene disorder running in the family, is also very important. We did a case of albinism recently where the first baby was an albino, or ocular as well as cutaneous, and the parents were not having it. We got their blood, we identified the mutation, and then we could create a primer and a probe for that. We created their embryos, and in the third cycle we found a normal blastocyst which was transferred and a healthy baby was born. Like that, thalassemia major, number of diseases we have done for a pre-implantation genetic diagnosis, where if the parents are having any single gene disorder or a sibling, we can see that the embryo that is transferred is without that disorder. And finally, I would say that science is advancing. The day to transfer embryo, the technique to transfer the embryo, and the uterus itself, the endometrial cavity, is also very important. So when you have a good team for all this, the chances of success increases. Supposing there is a patient of very thin endometrium, there are so many procedures available. You do a hysteroscopy, clean up the cavity, start the estradiol, and then there is a process known as endometrial rejuvenation with platelet-rich plasma. And that can improve the lining, and that can give the growth factors inside the endometrial lining, which will help the embryo to implant. Cycle after cycle, there are repeated failures. We can analyze the endometrium by the endometrial receptivity assay, the ERA test, and then decide the right time to implant the embryo. So, if you see, right from the egg to the sperm to the embryo and the uterus, the technology has advanced. The advanced centers with advanced technology can help you increase that 5% chances of success, which will eventually help you have your own genetic child in a shorter span. So, these are the newer techniques, and as and when we have our new technologies advanced, I will come up with it. Good luck to all the infertile patients looking for IVF treatment. Keep this in mind.